Hello everyone, let's try to solve this question together. So the blood glucose levels are shown below. This newborn infant responded to dioxide therapy and was labeled as having transient hyperinsulinemia. The transient nature is most likely related to, there are four choices given. What do you guys think is the correct choice? So here you see these are the levels of glucose, and you see that patient started with real hypoglycemia, which is persistent, and then at this point the dioxide was started here, and after that the glucose remains in the normal ranges. Right? So what do you guys think is the correct choice here? And the other information is given is the growth chart. So the correct choice here is that the patient was small for gestational age. As you guys can see, the infant was born at 40 weeks, and if you come up, you see that this patient is just barely making 10 centiles. So this patient is small for gestational age. Insulin does not cross placenta, so this insulin is baby's insulin, is not maternal insulin, so that should be out. Prematurity, the clue is here, the baby was not premature, the baby was born at 40 weeks, so baby is not premature. And the same thing, gestational age is not the cause here, because and gestational has nothing to do with hyperinsulinemia, which I'll show you in next slide. Okay, so here the answer was birth weight. And this is a very nice reference, and this is available online. If you guys can pull, this is an open article, as you guys can see here. So here they talk about that transient form of hyperinsulinemia is commonly seen in infants who are small for gestational age. What happens is small for gestational is twofold. First, they are short on glycogen storage and their insulin response is inappropriate. So that's why they might end up with hypoglycemia, a prolonged one. So this is the reason here. The same article further talks about, this is the same article reference, further talk about, look at the green component. The green highlighted things are significant. They found significantly associated with transient hyperinsulinemia, while gestational age and prematurity were not associated with hyperinsulinemia, the transient nature. So again, very important, we as a pediatrician and neonatologist and a healthcare provider working with neonates think that it's large for gestational age babies that are at risk for hyperinsulinemia. Small for gestational age babies are also at risk for hyperinsulinemia for the reason as aforementioned. So do look at this article. Like I said, this is freely available. The other good article is in Neo Reviews. If you guys have access to that, this is again freely available, and here they talk about two types. One is transient and one is congenital. The baby presented has a congenital type. There was no history of diabetes in the mother, so this baby qualifies into the prolonged one. And here it says that the prolonged jaundice could be in the small for gestational age babies, and of course the other two are birth asphyxia and maternal toxemia. So again, remember the point this presentation is making is that transient hyperinsulinemia is to be considered in small for gestational age babies and neonates, and sometimes this can last up to weeks. So another question is that should we just observe and not start diazoxide? That is a clinical call, because you cannot predict which baby is going to have a spontaneous resolution or which baby is going to have a prolonged hyperinsulinemia. So if you have to err on the side of starting diazoxide, start it and gradually taper it and follow up with in the clinic. And you can, other option is you can just watch and see if the serum glucose comes up spontaneously, because ultimately this is transient. The hyperinsulinemia is transient in nature. Ultimately the baby will get better. But if not, then you always have to consider the genetic side of it, which they talk about here. And if you can pull the article, there are many other types of dominant and other conditions. And sometimes the baby could have, like we call pseudoblastosis, where there is a tumor in the pancreas that is excreting a lot of insulin. But that is a different category. So I hope you guys have learned something together today. You guys have a wonderful day. Bye.